Welcome back to everyone. I'm Christine Tulloch, and I'm a PhD student in psychology at Carleton University, and I'll be your moderator. So the next set of presentations will be from the two co-leads of the academia case, Janet Mantler and Nicole Power. We'll start with Janet. She's an associate professor in psychology and director for the Center for Initiatives in Education at Carleton. And her research interests are in organizational psychology and how workplaces can be improved to promote employee health and organizational well-being. Then we'll move over to Nicole. I'm not sure if I should introduce Nicole now or in between. Yeah, okay. And so Nicole is a professor in sociology at Memorial University of Newfoundland and Labrador, and her research is focused on occupational health and safety across different occupational groups. And of course, we're also really pleased to have Robin Whitaker as our discussant. Robin is a professor with the Department of Anthropology at Memorial University, and she is currently the vice president of CAUT. And she'll jump in after both the presentations. And I'll be monitoring the chat window for any questions that people might have and looking for the virtual hand raises. So, but I think we'll save questions to once Robin is done. So I'll hand it over to Janet to start.
Okay. Coming, and can you see?
Yes.
Oh, sorry, I got to get it into that mode. Okay, we can see that?
Yes.
Okay, thank you, Christine. So I'll be talking today about how academics manage their mental ill health at work, acknowledging our full team, which of course is me, Nicole, Christine, Henrietta, and all of our, I don't have my notes here. Okay, let's do that. And our TAs along the way have been Sam Morton, Christina Young, Justine Pascal, and Natasha Ball, who I think just entered the room. And a great shout out actually to Ivy for organizing all of us who are all going off in different directions, and also to Sarah Simpkin, who in the end is the one who organized the survey and did the most amazing work, because that was a big beast of a survey and she got us all working together. Okay. So I'm going to be presenting on both the qualitative and quantitative work. For the academia case, we had 354 responses. The mean age was 49. Most of the mostly women, 70% women, and just over half were tenured. For this presentation, I won't be looking at the differences based on gender, academic position, or discipline. I just wanted to look at the data overall. And for the interviews, we had 34 interviews with 14 men and 24 women. And we tried really hard to get a wider representation of academic position. So we still had more tenured and quite a few tenure track, and then a lot of part-time adjunct and even professor emeritus in here. So similar to what we're hearing from other cases, we had 64% of our survey respondents reported a mental health issue at some point in their career. It's also important to note that 64% said that they did, but not everybody who has a mental health issue actually acknowledges it. It takes a long time for people to understand that they're doing quite poorly. And we had one research interview participant who said she knew she was depressed, but she didn't know how depressed she was until she was driving one day and was considering whether it was better to drive in front of a train or drive off a bridge. So when we're talking about the number of people reporting mental health issue, it's quite possible it's still underreported. In academia, in contrast to many of the other professions, the most commonly reported mental health concern was anxiety. Then it was followed by psychological distress, burnout, and depression. And so there were very high levels of anxiety. And question is then why? Why is this different from many of the other occupations? And one possible hypothesis is that we are working under the sword of Damocles. There's that imminent and ever-present peril. We're living in constant fear of impending doom. But what's that impending doom? It's that academic pressure to keep producing. There's that anxiety about having so much to do and not being able to get it all done. And even when you get stuff done, there's more to do. And some people say, well, you only have yourselves to blame. You could have been saying no all along. But what we're arguing is that actually the expectations of academic culture are so pervasive that this affects every academic, that we're all subject to this workload pressure. And that's why we're all feeling so much more anxiety. In addition, academia is a greedy institution. Meredy will talk about this later this afternoon. It's that expectation that members will give their undivided commitment to an organization, and work should take precedence over every other part of your life. So in academia, there's this sense that no amount of productivity will ever be enough. There's another quote from a participant that's not up here, is that the culture will continue to push you. There's this constant escalation agenda. You did one thing, now you've got to do the next step, right? You've gotten published, now you need to get published in the best journals. You've gotten published in the best journal, now you need a book. You've written a book, where's your next book? There's never this feeling that you can step back. So now that we've established that academics do have quite a few issues with mental ill health, how do they manage their mental health? In our sample, in the survey sample, 122 made informal changes. They reduced their workload and retreated, and quite a few sought social support. So these are informal changes. And when I say retreated, it's things like they took summers and sabbaticals, any non-teaching time, to recover, to let themselves restore. It means that they retreat. They don't go to department meetings anymore. They stop being engaged in academic life. They go to campus solely for teaching time. Interestingly, only 12% of our participants sought support from the union. And so that gives us a sense that maybe this is where unions can step up a little bit. And I think Nicole will talk about this later, that there is a chance, there's an opportunity for unions to take the lead in helping our in academics. So more academics sought formal support. 174 said they accessed things like a psychotherapist, a family physician, or the employee and family assistance plan. And again, this is overall, and what we were seeing is that more people with tenure were able to do this. So a lot of people went to their family physician, sometimes as a primary source of support, the first contact, but also because you need a physician's note in order to take a leave of absence or to get any accommodations. Of note, we have one person who talks about EAP. So we have these supports, but they're often not very effective because they're very short term, and then you don't know where you can go from there. And interestingly, only 25 participants in the survey tried to access or accessed formal accommodations. Of those, it was mostly reduced workload. That number is surprising and yet not surprising. So people are legally allowed, they have the right to reasonable accommodations for mental health. And those accommodations are modifications intended to help overcome work performance limitations. So we have the right to accommodations. And why don't we ask for them? Because in academia, we don't know how to accommodate people. It was mentioned, I think, in the doctor's presentation in the medical case earlier, that there is we're expected to be full on or full off. And a lot of people think that if you're asking for accommodations, you're just trying to get out of teaching in order to do more research. And we don't know how to accommodate someone to say, you need to work at 75% capacity or 80% capacity, and acknowledge that in our research expectations as well, that how do we make it a fair workload? So of our participants, 53 took a leave of absence at some point in their life. So many more considered it, but it was really hard for people to say, I am going to go on leave and find the pathway. So why didn't they? In our case, it was mostly that they did not think it was warranted. They didn't think that they were sick enough, that their mental health was damaged enough, in bad enough shape, that they should take a leave. Instead, they thought we could just power through. I've just got to get to the end of the semester. And because academia has that ability to retreat, to hide, openly hide, often we just wait till Christmas and then we say, I can take a few days off then. There is also, as we've seen in other cases, concern about professional impact. If you get off the academic treadmill, even for a very short period, it can have long-term consequences in terms of publications, grants, and therefore promotions. And finally, there was a great deal of concern about the impact on students, particularly graduate students or those you're individually supervising, and the extra work, the guilt over extra work for colleagues. If I can't teach my course, I don't want anyone else to do it. They're already overburdened as well. So instead, as I've mentioned, academics tend to self-manage and take hidden or informal leaves. They might talk to their department head, but they might not. I had a faculty member when I first started my new role who was on a month's grief leave and never told me. It was only after 3 weeks when someone said, oh yeah, he's away, that I actually found out what was going on and said, we have to follow the rules on this. So we use the academic cycle. We take summers and sabbaticals. And we had one participant who talked about making sure that he had enough work in his pipeline, so that he could take a leave and have no one notice. So as long as you still can get something on your CV for the year, then you can do that hiding. So what that means is that we have a great deal of presenteeism in academia. So presenteeism is working even though you're sick. So we often think about that as people going into the office or work when they have cold or flu, but this pertains to people who have any sort of mental ill health and still show up to work. So for academics, it's doing the bare minimum and not telling anyone that they're unwell. One participant talked about being able to get and do lectures, but wasn't even able to grade multiple choice exams until the end of the semester. And there's a high cost to presenteeism for academics. So we're not keeping up with our work, but nor are we getting help at the same time. So it's just becoming quite a negative spiral. And so we also know that these are not individual problems. It's just not that some people can't handle it. These are systemic problems with workload that span all of academia around the world. And we can't solve systemic level problems with individual level solutions. We can't just do more yoga or, take our summer vacations. We actually need to think about how do we manage workload expectations in academia overall. And I'm going to end the talk with a text that I found particularly appealing, even though it's not from one of our participants. And this person writes, cancel class for the rest of the week because I'm a few weeks into an anxiety depression flare-up and I just need some time to rest. Not posting for any other reason, but to normalize treating mental illness like any other illness. And we do need to do that. We need to treat mental illness appropriately like another illness and help people out. And so again, thank you to all of our partners, particularly CAUT and all of the other unions who have supported us through this research.
Okay, so thanks, Janet. And I guess we'll just move on to Nicole. You're good, Nicole?
Yep, I'm just gonna.
I know it always takes a few minutes. I know I've been using Zoom forever now, and it still takes me a while to find the share button. Okay.
See that?
Yes. You're in, yeah, there you go.
We're good?
Yes.
Okay, great, thanks. So thanks, Janet. Janet's presentation does a really good job, I think, of presenting some information about the quantitative as well as the qualitative pieces of the project. I'm going to do something perhaps a little different. I'm going to turn our attention to the employer a little bit. Most of us who work in universities don't often talk about the university as the employer, but it is indeed an employer. And so to do so, I wish first to situate my talk in terms of the broader literature. I'm a sociologist, so this is how I do my thinking. So I want to situate my talk in terms of the literature, the broader literature in the UK, US, Australia, and Canada that focuses on the lights have gone out just in my talk. Sorry.
Yeah, for anybody who missed that, Nicole is in an office where if she doesn't move, the lights automatically go out.
Sorry about that. So I'll start over in case for the editors of the video, Ivy. Okay, so I wish to situate my talk in terms of the literature in the produced in the UK, US, Australia, and Canada that looks at the restructuring of universities towards market interests. And that connects this restructuring to broader neoliberal trends, including reduced public funding for higher education. And this restructuring has involved new managerial practices in universities. And I'm quoting scholars Ross and Savage here. These managerial practices extract greater value from faculty labor in the delivery of the commodity called education, end quote. So in this presentation, I hope I'll be able to show how university wellness programs are part of this kind of managerialism, in that they encourage faculty to seek out ways to address structural problems or structural sources of stress in individual ways, and that reorient faculty autonomy and flexibility towards work intensification. And to do that, I'm focusing on the qualitative interviews that we did with 20 stakeholders. Those are folks who work, for example, faculty union staff, human resource staff, equity officers, academic administrators, and so on. So we did 20 interviews with stakeholders and 34 interviews with faculty and other academic staff. So while there's certainly variation in terms of dedicated mental health resources and infrastructure across universities, our interview participants most commonly identified services, programs that were aimed at what I'm calling employee wellness. And there's a list of examples here. The content of these programs often draw from materials and resources produced by corporate, government, and nonprofit sectors. Examples would include content from the Canadian Mental Health Association, Morneau Chappelle, or LifeWorks, I think they're called now, Bell's Let's Talk, Mindwell U, and so on. So the whole industry. Wellness initiatives point faculty members to programs like yoga at lunch or online mindfulness resources to alleviate stress, and to things like academic coaching, training, workshops to better develop mental health awareness and to learn strategies to better manage productivity and interactions at work. So one stakeholder here gives the example of verbal judo that provides some de-escalation strategies, and continued to say, if you want the tools, you can find them somewhere. So individual faculty members are expected to seek out the appropriate services. And as with the case of verbal judo, the aim is to acquire a tool or a strategy that presumably the faculty member doesn't have. And this in turn allows them to get back to doing their work. And faculty that we talked to often found these programs on an individual level very useful. And as one academic described here, free yoga in their building provided a space to feel like they were part of a larger community. At the same time, faculty and stakeholders alike offered pointed critiques at such programs that, in one faculty member's words, didn't address the root of the problem. One stakeholder quoted at length here said, "I think we know the systemic issues that they, faculty, are facing in terms of whether they are tenure track or not, and the pressures that they feel and constantly being on and working all hours of the day and that sort of thing. Working within that system, what can we do to support? If it's not a lunch and learn or it's not yoga at lunchtime, what is it and what would be the most impactful?" So this quote suggests that there are real limits to the kinds of mental health programming being delivered. Instead of addressing structural sources of faculty stress identified by the stakeholder in this quote, we're left with a suite of wellness services that tell faculty they just need to be more mindful, do more yoga, attend another workshop, and so on. The individual, we've heard this in other presentations, the individual is the target of these interventions. And furthermore, this individual is generic and decontextualized. I don't have time to get into that too much here, but we do know that these programs do not tend to take an intentional gender lens or an intersectional lens. And yet we know that the organization of academic work and the values embedded in academic work tend to marginalize women, racialized and Indigenous faculty, and the precariously employed, among others. So how does mental health programming then operate to extract more and more labor from faculty or value from faculty labor? Mental health training aimed at faculty in management and administrative positions, among other things, tended to focus on identifying the signs of mental ill health in faculty, with a very particular emphasis on performance and performance issues and poor performance. So again, I'm quoting a stakeholder here. It's always a question that we ask when someone's presenting the performance issue is, what else is going on for you? Like, let's hear, what are you at this point of frustration? Why are you at this point of frustration? What's been happening? So to be clear, performance issues may very well indicate mental ill health, and mental health undoubtedly impacts work productivity. At the same time, positioning performance issues as something going on with a faculty member redirects attention away from the intensification of academic work. And here, this quote nicely illustrates this point. She says, the university, it's a greedy employer, and no one's ever going to be like, you got $500,000 in funding this year, like you're good. Instead, I feel like, now everyone expects me to publish 12 articles. And if I don't get 10 articles this year, I'm a loser. So in interviews, faculty pointed to pressures to publish, get grants, and the constant review, reporting, and auditing of their work as key sources of stress. And as this quote tells us, feelings of insecurity and feelings of not having what it takes to be in academia drive faculty to work longer hours, to produce more and more, and in order to hide their experience of distress and anxiety from appearing in their CV, because the CV is the only thing that counts. And for women, racialized and other marginalized faculty who disproportionately do academic housework, service work, emotion work, work that is, by the way, very undervalued by the university, and women who are disproportionately responsible for family care, the flexibility that we value in academic work essentially translates into working all the time. So again, another person quoted at length here. I have a ton of flexibility. And so I do work at weird hours. But if I want to get up at 4 o'clock in the morning and start working, I can do that, right? And then get a bunch of stuff done before I have to be on with the kids, take care of them, and then work all day. After that, and then again, so cooking and cleaning and the stuff, it's challenging trying to keep everything together and keep track of all the stuff. So the academic life in that respect is very flexible, right? So just by way of concluding, employee wellness programs may provide some relief to individual faculty, I've tried to make the case that they serve this broader agenda of neoliberal managerialism that aims to extract more and more from faculty labor. And my hope is by framing it this way, we can think about mental health as a site of resistance for unions and faculty associations. In other words, I'm thinking, mental health is essentially a labor issue, and therefore fits within the wheelhouse of labor union activism, collective bargaining, and negotiations, and so on. And I can say a lot more about that, but I do want to add that I'm speaking as somebody who does a lot of work with their faculty union, and who's also been a grievance officer and been part of the collective bargaining process. So I need to take my own advice. Thank you.
Okay, thank you, Nicole. That's a great presentation. And we'll move over to Robin Whitaker, who's our discussant. And I'm sure most people are aware that CAUT, of CAUT, but for anyone who's not, I'll just mention that CAUT is the national level representative for academic staff at universities and colleges across Canada. And Robin is currently in the vice president position at CAUT. So over to you, Robin.
Okay, thanks so much, Christine. And thanks to Nicole and Janet for your excellent presentations. And I just want to start by saying that for Nicole, she wasn't just involved in collective bargaining, she was the chief negotiator for our union, so co-chief negotiator. So maybe this is a symptom of some of the things you're talking about, that you didn't mention the intense role that you've played there. Thanks also to the whole team for the vital contributions that this partnership is making. It's so interesting to see where there are common issues showing up across the professions. And there's already been a comment in the chat about that, and where things are distinctive in different areas. And I'm really grateful to have the opportunity to add to the conversation today. So let me just start by saying that I especially appreciated both the gendered and intersectional approach and the attention given to structural issues in this research. It puts me in mind of the Feel Tank Chicago, a feminist collective focused on public and political feelings, and they had a slogan, "Depressed, it might be political." So I'm sure many academics would nod in recognition at your observation that all too often our employers answer a systemic or structural problem with an individualizing solution. And, as Nicole observes, a solution based on individual self-management would go something like this: anxious or burned out, it must be your personal failure to manage your unmanageable workload, or worse, your failure of self-care. So one striking aspect of the presentation and the final report is how many of the conditions that participants reported as contributing to mental ill health also make it harder for academics to address these health issues by asking for accommodations or leaves. For example, academic workloads are intensifying in part because academic staff complements are shrinking, which in turn makes it that much harder for academics who worry about leaving both their colleagues and their students in the lurch to take the kinds of formal accommodations that they might need. But of course, they may need them in the first place because of the situation, that situation that makes it so challenging to ask for them. Similarly, as both Nicole and Janet showed, many participants identified pressures based on continual evaluation. This myth that once we get tenure, it's just a free ride forever. Yes, and then continual expectations about productivity. And again, I think these are exacerbated as governments cut operational funding to post-secondary institutions. Again, the shrinking complements, but also administrators increasingly look to academic staff to make up the shortfall with grants, or to outcompete our colleagues in other academic units by attracting more students, so we get more baseline funding, all of which exacerbates anxiety, insecurity, and does nothing for good relationships between colleagues. So little wonder, as Janet noted, that academics often manage their mental ill health through informal individual strategies that leave the overall context unchallenged. So what I want to do just to end is to raise a few questions for consideration and discussion. And the researchers might have responses, but so might others. So first of all, just given the gendered dimensions of the research results, and this is something that Nicole noted, I think, towards the end of her presentation, it's not just the people that are gendered, it's also our work itself. And in particular, there's widely recognized the gendering of the so-called service component of our work, work that's often referred to as academic housework, and that appears in the final report for this team. So I wonder, again, on unions, might unions have a particular role to play here, given how service work appears in collective agreement language, including promotion and tenure criteria? Is it time that we reconceptualize this aspect of the academic job and its relationship to research and teaching? And what can we do to achieve a more equitable division of labor, since that is one of the conditioning factors for some of the mental health issues that have been identified? On contract academic staff, I think academic unions have seen success in negotiating seniority protections for contract academic staff, but then that made me wonder if we've been paying enough attention to ensuring that contract academic staff don't need to worry that they're risking their seniority if they take a leave or they need to step back or ask for other accommodations. We didn't hear a huge amount of it in the presentations, but it certainly appeared in the final report and elsewhere that the pandemic context exacerbated many of the stressors, and particularly for women and for contract and tenure track academics. And this may be a question for future research, but I wonder about the post-pandemic context. And I'm thinking in particular about the questions of extensification, that sense that we can work anywhere all the time, and presenteeism now that we're all set up to work from home. And I'm guilty of this. I had COVID for the first time at the end of the semester, this just past semester, and I taught my last graduate seminar on the couch. And, pre-pandemic, I would have just been sick and unable to go to work, but I felt, oh, it's the last class for grad students. I really need to be there for them, be there. But I also wonder about the risk that the increased tendency to remote work, while it clearly has benefits, as we're seeing here, we can all talk to each other across the country. If that increased tendency to working virtually in meetings and so on routinely might create deficits in social engagement and challenges to collective responses, and our ability to kind of push back in a collective and organized way. And so then finally, again, just returning to the role of union, since it's been raised, just to raise the question about where is the arena for action? And I think, the immediate issue is the workplace. But we may also start thinking about wider arenas and organized political responses beyond our individual workplaces, perhaps working with the wider labor movement. And I think some of the challenges we're seeing in our workplace as academics are reflective of a wider kind of hollowing out and responsibilization, to use Nicole's framework about neoliberalization, responsibilization of public institutions more generally, where, we've had so many cuts to public funding, institutions are insecure, and so forth. So thanks so much. It's a very stimulating day and set of presentations, and the research is excellent and so important as we move forward on these questions. Thank you. And I think Christine is going to help with keeping track of questions and comments as they're coming in too.
Yes, I did forget to say at the beginning to encourage everybody if they have a question to either, raise the virtual hand or put your questions in the chat. Yeah, I know we had one comment earlier from Carolyn speaking about sort of acknowledging that sort of this intersection between occupations and academia. So, our medicine team and accounting, nurses, and education, and I'm sure others, they, not only have that clinical or that applied work, but they're also academics.
Carolyn's got her hand up, so maybe she wants
Oh,
to jump
there you
in.
go. Thank
Yeah.
you.
This was just to acknowledge that, so when I was working at the faculty wellness program at the Faculty of Medicine, the mandate was not just for learners and practicing physicians, but it was also for the grad students. And it was really eye-opening for me to learn and acknowledge the amount of stress that students and staff were under in the labs and in the research departments. And in my mind, and I don't know what the group thinks here, but the lack of control was one of the key factors. Those students were at the mercy of their supervisor, and they just felt like they had zero control in terms of time, or let alone taking a leave. And the immense pressure, you've all spoken to the competition, the pressure to continue to produce. So so I'll finish my comment by saying, Chris, Simon, and I at the Canadian Medical Association, we're starting to think about wellness, and I appreciate the use of when we talk about mental ill health. I really like that term because it speaks to the spectrum, right, between all layers of health and unwellness. But Chris and I are starting to think about wellness more in the really occupational health and safety lens. And so just to kind of plant that seed with this group, that we're all tying a lot of mental health issues to the work environment. So there may be a newer lens to use as we're trying to find solutions for this. So those were just my comments. So many similarities between a lot of these different groups. I think this is fantastic. Thank you, Christine.
And actually, I had in an earlier draft thought about asking about the role of joint occupational health and safety committees and cut it out because I didn't want to. So I don't know if Nicole or Janet might want to chime in on those. There's another question that's come in as well about how the findings can be used to prepare or caution academic trainees or those considering working in academia. So I don't know, Janet and Nicole, do you want to?
I mean, I there's so many things I could say. So this study didn't focus on trainees in that way. Like, we weren't looking at students, but I will say that a lot of the faculty that we spoke to did speak about students. So, and they understood the sort of some of it's a new kind of stress, because I think there is an intensification of what we expect students to produce earlier and earlier in their sort of academic careers. Yeah, Janet, and folks did speak about those committees as well, actually, in interviews to be more or less effective depending on the particular case. So most of those occupational health and safety committees focus on identifying physical hazards in buildings, and they don't tend to do much work around psychological hazards, if I could put it that way. But so I think they could be, in fact, because they have a legal, they are they are mandated legally, so they are protected in that way, and they are enshrined, in a certain way. But I'm not so sure about the work that's actually getting done. Yeah, Janet?
Yeah, I think absolutely we should be looking at it through the occupational health lens, but it's so systemically ingrained universally that if you look at it in one organization, in one university, and you say, hey, everyone take your vacation, stop working at 5 o'clock, don't work 18-hour days, then those people are going to fall behind the rest of the academic world. And so when we think about interventions, it kind of blows my mind at how big we have to do, that we have to have some kind of groundswell movement among everybody to say, I'm intentionally stepping back from this. I'm not going to have 12 publications this year. You get 2. That's all I'm going to do, and have everyone agree. So this kind of conversation needs to be happening at all of our national and international conferences. What are we going to do as a discipline to do things differently? And in terms of the students, yeah, we are passing down all of our bad ways of working and training our students that way. I know at the beginning of this, sorry.
Oh, I was going to say, Janet and I talked about this, about the because I'm a final year PhD student and I've been on this project for the entirety. And Janet used to joke at the beginning that I've now seen behind the curtain sort of thing of what goes on in academia. And it's true, it was really eye-opening. I didn't really have any idea when I was doing my undergraduate work how much work is involved. And so, and it is, I think somebody had posted that it's a difficult conversation to have. It doesn't take too long, I don't think, into graduate studies to see sort of what's involved. But I will say though, there is a huge role model component because you're looking around and you're seeing who's sending emails on weekends and evenings and who's working late and who's, that kind of thing. So there is definitely a role model component when you're looking around and you're seeing, I'll put in quotes, the successful people and seeing what they do to be successful and deciding. But I mean, it's good to be aware of it because, I mean, you can sort of make a decision sort of earlier on, am I going to be, sort of which kind of role model you're going to follow. I think I interrupted you, Janet.
No, I think that's great because I was going to say students on the research are all going, I don't think I want to do this as a future. But I also think that there is a lifespan thing that when we start early in the career with tenure, you have to get tenure and you work really hard and you burn yourself out, and there's a mid-career slump and then you work your way up. And then when you become senior, you can take a step back and go, why was I working so hard? Why was I killing myself so much for this? And then you say things like, oh, well, I'm going to tell everyone else not to work so hard. But you can only do that because you have the luxury of having been successful, of hitting the peak of your career. So it was yesterday or the day before, I was reading a blog post about someone who's very, very successful, has the books, 2 books, all the top tier publications, was the one who was lecturing from an elevator during the pandemic because he got stuck in an elevator. And he's like, he finally came to this realization that burnout is real and we should do something. So he's going to take, he called it a 10% retirement. He's going to work 10% less hard each day. But he can only do that because he has the luxury of being at the peak of his career. So we can't keep people in this treadmill until the peak of their career. And then they say, oh, now I can and work less hard.
I do want to say that I do think that we can think about pushing for concrete things. So for example, thinking about our current funding models for research, not only do they reproduce, systemic inequalities as they're currently constructed, but there are different ways to imagine how we can access as researchers money that we need to do our work. It doesn't have to be on a competitive basis as it's currently, with putting all of that time and energy into it and how, 20-something% gets funded. So I think this is a call to folks, the funders who are joining us, that there are different we can imagine and reimagine different ways of spreading out that work, or that money, that funding across disciplines and researchers in ways that are more equitable, that ensures that unpopular topics get funding, and not just so that we're getting, yes, we're researching topics of the day, but also innovation comes from funding things that aren't necessarily popular at the time. So that's one, thing that we can think about in terms of reducing some of that workload and competition and so on. I heard some other interesting proposals in the interviews with faculty, like we have caps on how much we teach. Why don't we have caps on how many publications we produce a year? Why not? It sounds reasonable to me. So there are actually concrete things that we can do, but this requires, actions on the part of faculty associations and unions, that those are not easy wins, but it also requires, I think, support from external institutions like our funding organizations.
I think we're at the end of our time, but I will say there's one other comment in the chat from Kevin. So thanks for that. He says, that some jurisdictions like Nova Scotia are now recognizing gradual onset stress disorders in the workers' comp frameworks. So which he thinks will eventually lead to organizations dealing with mental health issues through their OHS programs. So that's encouraging.
Oh, and also the interesting observation from Ivy that the Fundamental Science Review did suggest a different model of funding for research, but it hasn't been taken up. And I think it would, we don't have time today right now, but it would be very interesting to think about why it hasn't been taken up, and lots more conversation to have about that.
I pass back to you now, Ivy. Thank you so much, Robin and Janet and Nicole. That was really a great discussion, I think. And do I pass back to you now, Ivy?
Sure, that is wonderful. Thank you so much, Christine, and thank you for some great presentations. I put some of my comments in the chat, and I think everybody who is on the team, because they're all academics, we're all kind of lurking on this case study, and I think that there was a lot of resonance in what you found, really speaking to the embodied experiences that we had, which for myself personally, having taken a leave, not purposefully, during the context of this study, but ended up being a bit of an autoethnography in that regard. So thank you so much.